everybody, welcome back. We're now in week 3 of Nursing 2405 in our second semester, so congratulations. Today's topic is going to be on pneumonia. So the objectives that I want you to leave here today in the class is that you'll be able to define pneumonia, tell me the signs and symptoms of pneumonia, the diagnosis, and the treatment. Be also to, when you go in the hospitals and to the different facilities, that you'll be able to correctly assess your patient for whether or not they have pneumonia, and also identify the different types of pneumonia, which we will briefly talk about. What is pneumonia? According to our textbook, Hall, pneumonia is defined as inflammation of the lungs in which the alveoli sacs become filled with fluid or blood products. Causative agents, the number one causative agent for pneumonia is bacterial. Other causative agents is fungi, infection, chemical, and also bacterial. Gas exchange is going to be limited with people who have pneumonia because the alveoli sacs, which helps with oxygenation, is now filled with fluid, therefore decreased oxygenation, and oxygen is getting to the blood and the tissues. Signs and symptoms of pneumonia is going to be fever, chills, temperature, a cough, loss of appetite or fatigue, weakness, chest pain generally from coughing and from the diagnosis of having pneumonia, and also shortness of breath. Risk factors for pneumonia, number one is going to be cigarette smoking. Other is respiratory infection, those who have cerebral palsy, those who also have any kind of lung disease or lung infections, those who also are having difficulty swallowing, and last but not least, those who have a weak immune system. Diagnosis. Number one diagnosis is going to be through a doctor's assessment or diagnosis, basically when they're auscultating the lungs. We haven't got to lung sounds just yet, so I included a YouTube video, which there's a link, and hopefully you guys already reviewed that before class. If you have not, we'll go ahead and take about 10 minutes and go ahead and look at that video. Okay, so hopefully after reviewing that video, everybody got an idea of what lung sounds sound like for those who have been diagnosed with pneumonia. Other diagnosis is with a chest x-ray. Usually there'll be shadowing or either or a white shadow that's seen on the films that indicate the diagnosis of pneumonia. Doctor might also order some blood tests, usually CBC to look at the white blood cell count to check whether or not there's infection. And also we're going to be doing ABGs to also see how their oxygenation is going. We also might order a CT scan or sputum culture to know what infection that we're dealing with. And also we might do, depending on the severity of the case, the doctor might order a pleural fluid culture, which they go in through the back, and they're going to take a little bit of the fluid surrounding the lungs to see what the causative agent is. Treatment for pneumonia is going to be to drink plenty of fluids, to rest and stay hydrated, to take any cough medicines or either any kind of fever reducing medications. We're also going to be taking antibiotics. If they're in the hospital, they're generally going to be on antibiotics for 7 to 10 days. And if they go home, generally they're going to switch over to oral antibiotic, and beyond that from either 3 to 5 days. Also, depending on the patient oxygenation, we're going to have them on oxygen as well to help them get at least to that 92% or above. The doctor might order a breathing treatment, NEPS treatment, for them to be on here while they're at the hospital or even when they go home. Generally, the NEP treatments or the most general one they use is albuterol. Prevention. So usually pneumonia, you see it around flu season or in the winter months. So the number one spread is washing your hands. So we're definitely going to make sure that we're washing our hands, making sure that we're not touching any objects that could be contaminated. We're also going to make sure we're having a balanced diet. Make sure you teach your patients to have enough protein, fruits and vegetables, and water. Indoor exercise or outdoor exercise, even if it's 30 minutes a day, that's good for their health as well. Quit smoking. Either if they not use nicotine patches, reducing the amount of cigarettes they smoke a day, that's always a good start. There's also resources in the community that we can give our patients to educate them on to help them to quit smoking. Also, flu and pneumonia vaccine. The flu vaccine, you can get those yearly. You always want to educate that. Pneumonia vaccine, there are two types. The first type we have is PCV13. We generally give those to infants and young children, and also those who have a weak immune system. The other one is PPSV23. We usually give those to the individuals between the ages of 19 and 64-year old, or those who smoke or have asthma or any respiratory issues. With the PPSV23, we can give those to children as young as 2 years old. So now I want you guys to go ahead and divide up into groups of 5. Throughout the classroom, we're going to go over a case study real quick. Okay, so here we have an 86-year-old Caucasian male that has been admitted to the emergency room. He is a resident of the nursing home. He is complaining of shortness of breath, cough that's lasting for 2 weeks, with also sputum that is yellow in color. He also has early stage dementia. His vital signs are as follow: 144/62, heart rate 81, respirations 22, oxygen is 88% on room air, and he's running a temperature of 101. Medical history: he is a smoker of 42 years, has a history of COPD, dementia, hypertension, arthritis, and GERD. Also listed is his medical history. It includes an appendectomy, a hip, and a knee replacement. Also, his medications includes blood pressure medicine, aspirin, vitamin D, Aricept, and also something for GERD. So, what do you expect his diagnosis to be? Go ahead, take a minute and talk about yourself. Okay, pneumonia. So, what with our patient history is making you think that the patient might have pneumonia? He has a temperature. He has a cough with sputum that is yellow in color. He also said that he's been having that cough for 2 weeks. So these are all signs and symptoms, as we saw, that are symptoms of pneumonia. What treatments do you expect the doctor's going to order and treat him with? Okay, get a chest x-ray. Good, that's good. We're going to also order ABGs. That's good. His oxygen level was 88% on room air. Maybe put him on oxygen. That's good as well. Let's see what else. Antibiotics. Antibiotics, we usually start those after cultures. That's good to see exactly what is the causative agent. All right. So now your patient is going home. What discharge teachings would you do? Make sure he takes his antibiotics as prescribed. You also want to make sure that they're eating a well-balanced diet, that they get plenty of rest, but also stay mobile. You also want to make sure that they are getting around, washing their hands, and stay away from those that are infected. Those are all good. Okay, so that is the end of the presentation on pneumonia. Hopefully everybody has got a better understanding. The homework for today I want you to do is to have everybody to develop their own case study on a patient with pneumonia, or either do a brochure or either a pamphlet. Tomorrow we'll be meeting up to do our simulation lab in building 101B. There we're going to go do different scenarios of those who have pneumonia and those in different age groups. After that, right now we're going to take a 15-minute break, let you go to the bathroom, get a little snack, and then we'll come back and do a 10-minute quiz. All right, that's it. We'll see you back in a little bit.